All right, welcome back everyone to another virtual shadowing session at Hearts for Health. Today we are excited to be joined by Damaris. She is a board certified family nurse practitioner. This is actually going to be our first session with a nurse practitioner, so we're happy to open up to that new field. Hopefully we'll have some more nurse practitioners join us as we're trying to have a lot more fields join us. Since the summer, we've had PAs, we've had dentists, a lot of specialties actually in dentistry. So if you're looking forward to those sessions, stay tuned. I also have a few reminders for you later on, but just a little about Dr. Damaris. Yes, she's a board certified family nurse practitioner with years of experience. She's been in the military. She has experience with trauma, rehabilitation, community health, and acute pediatric care. So we're going to be seeing quite a lot. We're going to be seeing some different settings in healthcare, which is exciting too. For those who might be a little new to virtual shadowing, as a quick reminder, we do have a Q&A at the very end of these sessions. So if you have any questions for Damaris, feel free to type them in the chat. And once we roll around to the Q&A, I will read them out to her and we'll go through them in the order that we receive them. So just be sure to keep that in mind if you do have any questions. Also, for those who want to stay tuned, because we do have more shadowing sessions, we have usually a Monday and Thursday schedule to these shadowing sessions, typically at 7 p.m. Central. So just to stay tuned with the speakers, the specialties, maybe you're interested to see a certain one, you can always follow us either on Instagram or join us on our listserv, which is an email listserv we send out weekly on Tuesdays with, again, the upcoming sessions. We'll include the flyers. We'll include a little more about the speakers, and specifically over listserv, we do sometimes include some other opportunities outside of virtual shadowing. We do have quite a few other programs now outside of virtual shadowing. So if there are any announcements, we will also include them there. The same thing on our Instagram page, we do have posts, but we won't have those weekly opportunities included in the Instagram page. So you might want to join our listserv if you want to have those more frequent opportunities and stay up to date over that. That's really all. If you do have any questions for us or any concerns, there's a section at the bottom of our quiz, which we're going to be providing at the very end of this session, that you can communicate any of that to us. We also have our email, which people can reach out to for any questions about virtual shadowing or Hearts for Health in general. That email is shadowing.h, the number 4h at gmail.com. Whether it's that you want to be added to our listserv, or let's say you just have any questions for us, you can always email us there. Or another way to add to the listserv is that you subscribe on our website. At the very bottom, we have a subscription form. Just enter your name, your email, click subscribe, and you're going to be good to go for those weekly emails. That's all that I have to say. Again, if you have any questions, let me know through that email. Our team will respond to you. But with that covered, Dr. Damaris, feel free to take it away.
Hi, guys. How are you? Can you hear me good now?
Perfect.
Perfect. So nice to meet all of you, and thank you for coming on to this shadowing. And I appreciate the invitation, Michael, as a nurse practitioner, and being part of the the conversation in healthcare, and realizing that there's many areas of healthcare that you can go into. And I myself am a doctor of nurse practice, which is a doctorate in nursing, and I'm also board certified family nurse practitioner. Holistic, and I've also worked in emergency medicine. So I have an array of different things, and we'll go over that. But it's kind of my journey as a whole of what is like a nurse practitioner. We're going to go over that, where it was for me, pathways that you can kind of do, and what it was to be a DNP and credentialing and how that was. My path was a little bit different than most, but to be a nurse practitioner, it is still a respected and primary area. I mostly do primary care at this point, and I also do a lot of telehealth because of the pandemic. So I transitioned in primary setting, telehealth setting. I've done urgent care, ER, and also in integrative settings. So I'm going to kind of go over a little bit of those too. So what is like a nurse practitioner? So first off, there's many different types of nurse practitioners. So initially, board certified nurse practitioner can do disease prevention, can treat, can help be health management, a lot of whole approach because they're nurses. So initially they have an RN degree, which means they have a 2-year to 4-year bachelor's. Then they have a 2-year to 5-year doctorate, either a master's or a doctorate. So it's a you're certified by 2 boards of nursing, either AANP or the AANC. They can prescribe. We're usually part of a collaborative team. There are a variety of specialties as nurse practitioners. So there's family, acute care, anesthesiologists, CRNAs. There's midwives, those that are in different areas of, just like in a medical doctor has to specialize, a nurse practitioner has to specialize in the field that they would like to work in. They cannot just do wherever. They have to have years of training to do what they're doing. Benefits for me in my field, and the reason I chose my field is it was the transition, and I'll tell you more about it. But benefits for me, and as an NP, I have a great professional board. I'm with the AANP. We are backed very with a great amount of research and credentialing, and the nurse practitioner field has been around since the 1960s. It's first started in Colorado and has been progressively getting larger, and is a very large group of very predominantly educated and well respected individuals that work side by side with amazing medical team. So I say just team, not just my doctors, but the team. It's a collaborative approach. I work with such great people, so I love what I do. Now, the benefits of being of a nurse practitioner for me is that we're helping, fill some gaps in the medical needs, rural areas, telehealth spots, areas that the medical community absolutely needs to be specialists in. And the nurse practitioner roles fill in kind of those middle areas, sometimes even in independent clinics, but in a way to just give more patient care and more access for health. So for me as a whole health individual, and in that a nurse approach is more in that education and whole thinking. That doesn't mean that the medical side doesn't think that way. That's just kind of a different model of care and then overall treatment. And it's just kind of building, a rapport. So for me, the patient always is the center of the care, and then it becomes a whole health approach for that. For me, that's further. Now, initially, a traditional route for a nurse practitioner, they go to high school. They're in school. They get trained. Usually during that time, you're getting like an EMT training, a medical training, or you're shadowing someone, not fully a medical doctor or a nurse practitioner job, but you're shadowing someone in the medical field. So you're kind of figuring out what you want to do. You apply to school. You're usually applying to an accredited nursing program, and you need to finish a 4-year program. You can either do 2 years, but you still need to have a bachelor's degree. You graduate from high school. After you graduate from high school, then you go to your 4-year nursing program, or you can do the 2-year, then a bachelor's. You work for about 2 to 3 years. And then from there, you can apply for a master's program. Now, not every nurse practitioner has a doctorate, but all nurse practitioners have to be certified and specialize in their field. So for me, I am specialized in family practice, integrative, and emergency medicine. And I have a doctorate in clinical family, but I also have a doctorate in integrative health. So I use and incorporate my doctorate clinical work in my practice, but not all nurse practitioners have a doctorate. That is additional training. So it's around 2 to 3 years for the nurse practitioner certification. And then if they get further training and clinical specialties, they can also do fellowships, just like in a medical needs, you can also do fellowships. So if I was going to work in a perioperative area, I'd have to do a fellowship. If I was going to work in hematology, oncology, I'd have to do a fellowship because I don't have that training. So these are, just, they have to be taken very seriously. You can't just go and think, oh, I know how to do that. To become a nurse practitioner by the board, I'm certified by the American Association of Nurse Practitioners. And as I said before, you have to have a bachelor's initially, and then you get your RN license. So you take an RN exam for that. Then you go through a graduate program. After a graduate program, then you have to take another board certification. I have taken two, and overall, just like any exam, it's not easy, but with time and effort and a lot of practice, and especially if it's something that you want to do, to be in the medical field, whether it's a nurse practitioner, a doctor, or any area of collaborative care, you really got to have love for taking care of the patients, because those are the ones that's what it's about, and the care and coming to that. So my why of why I chose nursing over being a doctor, not that I didn't want to become in the medical field. I always wanted to be in the medical field. I actually had a tough childhood and a tough background, but I was premature. I had nutritional deficiencies, and I was adopted from. I'm Hispanic and Black, and I had a learning disability. I had a real struggle with just in general life. I was in care and fought. My story isn't really what my journey is. My why is that I never gave up on wanting to help someone. I never gave up on wanting to be in the medical field. I never gave up when things were said, hey, maybe you may not be able to go to college. Maybe that may not be your path. But what I learned through all of my training and through time and through effort is that you can't stop. You can't give up. And so my journey is a little different than some of the nurse practitioners that you're going to hear. But if nothing else that you get from me is that I love what I do, I love my patients, and I do not give up. So I never stopped learning. I just kept taking classes, one class at a time, one class at a time. I'm actually a 9/11 veteran. So I was in after high school, I guess because I had a little bit of struggles in the typical um high school time. So for me, I didn't go to college right away. I went into the military. So I used my military training to get trained in military trauma. I was in during 9/11, and I took that time to help me transition into my nursing career, because I learned a lot, and I was deployed twice to the Middle East during 9/11. So I saw and did more things, I think, at my young age that really kind of changed my perspective, even more on health than I had realized. That's why now I call myself an integrative family nurse practitioner, not just a family nurse practitioner, because I really use a lot of different elements of holistic approach. That is very different than you'll hear from other providers. This is just approach that I have learned and now utilize. So my general journey in the healthcare field was I was military trauma trained because I was in the military, and from that time I had been injured and I had an illness. So I had to figure out some ways to figure out my life, but I knew in the training I wanted to be in medicine, but I didn't know what I was able to get. So when I was in trained, I was able to begin and certify as an LPN very quickly, because my military training, my trauma training gave me an LPN license. So I was able to use that. And then everything from then kind of worked together. I wasn't sure where I was going to go, but for my journey, I became an LPN, then I became an RN, then I got my bachelor's, and then I got my MSN, and then I got my doctorate. So it took a little bit more time than most people, and it shouldn't take that for everyone. My journey, like I said, is a little different. I am certified in integrative health, family health, and functional medicine because I knew that there were additional things that I wanted to add into my care for my patients. So that is my reasoning for that. And if you have more questions on that, you're welcome to ask me at any time. So, where do I work, and what is it that a family practitioner works on? So, most family nurse practitioners are usually working in clinics, in primary care, or in emergency or urgent care settings. So, as a family nurse practitioner, because I specialize in babies all the way up to adults, when I was an RN, I did a lot of acute care, pediatrics, and ICU. And then, so for me, the pediatric world was was part of my family care. So when I certified as a family nurse practitioner, it was pretty comfortable because I felt in cultures, a lot of families really bring the mom, the dad, grandma, and the baby, and everybody kind of wants to be taken care of. And it was important for me to be part of that education. I didn't just want to treat one thing. So I really wanted to kind of be part of the family unit. And a lot of it is the mom has a question about something and has a question about their baby. So I kind of want to be part of that situation. I'm glad to say that because of the pandemic, I have been able to shift my and pivot part of my career into telehealth. And I have an over 10 licenses in as a nurse practitioner now, and I'm able to see patients throughout the country. So it has really helped me even more so to be able to see patients and give them access to care in many areas. So I'm kind of happy in that end. I also do house calls. I have a small practice and I've worked for another company doing urgent care and travel work. So I've been able to utilize um my degree in many ways, but I've been able to help. And the main focus is really trying to give access. So the pandemic, even though it was had some negative moments, I really felt that it was a pivotal time for healthcare because what it has done is has opened providers to understand that you can still give care, not everything, obviously not procedures and some diagnostics, but I will tell you this, on my telehealth practice, I can do about 80% of care if I send out for diagnostics. And I can send majority of patients I can send out for some sort of diagnostic locally to them and then get help. And it means I can't fix everything, but I can do a lot that I may not have been able to do before for someone. And then locally I try to help in the house call area. And the good thing about family is that you can work with young to old and and then specialize depending upon your need of where you would like to work. And then I have worked for different digital companies and consulted with them to give them advice on where I've worked for a couple major digital companies that have utilized telehealth work. So the cool thing about family, like as a nurse practitioner and as a doctor or in the medical field, there's many areas you can kind of get involved in. And if you look at it in the most altruistic way, I mean, in my opinion, if you look at trying to do good and making an effort to educate and give value, then there's so much that you can offer others. So as I was saying, as an integrative family nurse practitioner, I take in consideration all of the time the mind, body, spirit medicine and whole health. That does not mean that I don't believe in traditional medicine, because I 100% my background is in a whole health approach. So I look at evidence-based research and I use a full whole approach, and I've been certified in that area to treat. A lot of my care is done in I call it stress transformation, but a lot of stress management. A lot of my patients need chronic care management, and it's a lot of discussing and educating patients. It's not always just a prescription. So a lot of my time and my effort is really listening and kind of tuning into what the patient's needs are. And then sometimes it's just getting their follow-ups, or getting them into the office or into the conversation so that they'll have a screening. So, depending upon the age, we have these guidelines of where they should get screened. Sometimes it's getting them into the office or on a Zoom call to just have the conversation. Did you get your pap smear? Did you go for a colonoscopy? Can we discuss it? Let's look it over. Did we go for labs? Do we need to get something else looked over? And and then just having that mental health conversations, just having these one-on-ones. I don't have a psychiatric certification, but I do a lot of mental health education for my patients because they just need to be heard. Sometimes they don't always have that available person that wants to listen. And I am grateful for on the telehealth side because I've actually found that I've been able to give more time for them. And of course, like, I do a lot of weight management conversations, tobacco and alcohol cessation, things of that nature. As you can tell, education, education, and a lot of empowering my patients. It's a little bit more effort. It's different than just doing a bunch of procedures, but I do some procedures when I'm in the urgent care and ER environments. So a typical day for me lately, it depends. I wake up and journal. So this is on a day if I'm in a local clinic, or even a telehealth clinic. So it depends upon the day. But for me, a typical day is I'll wake up, I do a little journaling, some meditation. I have a little toddler, then I get him up or he wakes me up. A little coffee, and then I start looking at what my online visits are. So I initially will do some telehealth in the morning and then I may go to the clinic or I have a full clinic day. Now, if I have a full home day, I'm still doing patient care at home. I am still seeing synchronous and asynchronous visits. What a synchronous visit is I'm doing just like I'm talking to you guys on a video, I am talking to a patient on a video, and I'm still doing my medical journaling and my medical diagnosis and coding on a chart. So I was just telling Michael that I have a two screen because I literally have one screen for usually my patient care and my one screen for my EHR. So here I am, there jotting out what my day is. So I'm still seeing those patients as if I would see them in person. I'm seeing them, on a calendar time, and they're still being seen. And I'm still doing screenings. I'm still, putting in for the lab work. I'm still putting in for their needs for the day. Now, due to COVID, obviously there had been less in person, but I still found a way in my practice, and I call it and more you'll see of this is that you can actually get diagnostics in most areas, or there are a lot of great remote diagnostic tools that can be sent to patients. So I started to utilize companies and partnerships and send them different types, or advise them which types of remote monitoring. Now, remote monitoring means that, so if I have a stethoscope and it's a remote monitored, or they have a stethoscope, I can see the information over the internet, or it's synced up. One major one that I use on a regular to tell people, I'm a big fan of wearables. So I have patients, because I do a lot of chronic health management, I really advise a lot of my patients to wear a Fitbit, a cheap stepper, things that will give me like a basic heart rate. And granted, they're not perfect and they're not giving me everything, but what at least gets me to do is empower my patients to say, oh, I'm looking at my watch, I'm going to step. I'm kind of seeing where their heart rates might be. I can get a diastolic heart rate from that at resting. I can see if the trend, and I get the trends back, I can look at information of that nature. So things of that has been helpful. I then will, if I'm going into the office, I'll be in for the day. If I'm not, then, I'll be home during lunch, and then I'll go for some home visits. If I have home visits, usually I'll do those in the afternoon, depending upon the situation. And then I still finish up with charting too. So just like you have to chart in at work, I still have to finish up my bleeding patient needs. I also have some of my patients do text messaging, so they can text me at different times for their needs, and or through HIPAA compliant, meaning it's all through secure text messaging or through my EHR. And then after that, I try to get home to, dinner and get to my little one to bed. Now that's on a perfect day. Now, if I have a 12-hour urgent care day, I'd make it work. But that's a typical day lately for me. I tried to put in here 3 different cases that I see. So one is a telehealth case, one is an urgent care case, and one is a in the clinic case. So different cases that I would see, like one would be in person, one would be online, and one would be like an actual emergent kind of thing. So here's a telehealth visit that I would kind of see on a regular. This is a 41-year-old female. She complains of a headache. She's got some face pain, nasal congestion. She calls up and says, or text messages the clinic or myself, through the line, and, needs to be seen, and said, oh, what do I do? It's been really bad. So initially, she said she's used Tylenol to alleviate the pain over the counter. Her pain's 5 out of 10 and it's getting worsened. Pressure increased, maxillary and ethmoid regions have been pained, meaning front and are the pain are I don't know, everybody is very well versed in terminology. And then she's had some obstruction with breathing. Now, she feels that she's had a little bit of discharge. She has some smell is minimal. Her vitals at this time, 132/74. Temp has been okay, and pulse is 72. Now, initially, it didn't seem like too much, but I started to kind of go into the history of kind of asking her any allergies, any exposure to anyone else being sick, things of that nature. Um, and then she also had stated, that she has been, she has a history of having infections, but usually she doesn't get seen that often recently, but would like to be seen. So in this case, and I asked, my main first question is, how long is this going on? She said 7 days. My next question is, how have you gotten antibiotics, or when's the last time you got antibiotics? And she would say, in this case, she was said a year ago. I'd be like, okay. So for me, I try not to prescribe antibiotics unless it is unless it's necessary. In this scenario, it was pretty understandable in the sense of she had a lot of showing. So on screen, as we're on screen, what I tell that patient is, okay, so I'm trying to do a diagnostic, somewhat of an idea. I will have them bring the camera to their throat, and I will try to have them try to bring some light to that area. So if I can maybe get an idea, I'd want them to they'd have them describe. So in my notes, I have a lot of what patient states or what I may see on a video. I'm asking them, so in clinic, I would be doing palpations of these areas of their face and of the nose and of their lymph nodes, and checking. I may not be able to do that in the screen, but I am trying to get at least an idea. I'm also then asking them history of rashes. I'm asking them history of other kinds of pain, stomach, and then there's with sinus infections or strep throats, the Centron score. So there's different elements there I will ask. So it's a lot of history taking. I don't recommend my advice to someone that wants to go into telehealth. I do not recommend telehealth in your first few years in practice, whether you're a nurse practitioner or doctor, just because there's so much in person that you need to understand before you can really take someone on video and be comfortable, be like, okay, it's probably this, because there is a lot of history and understanding of and an experience that you want to gain, so that when you go on to these visits with these patients, you feel very comfortable asking them anything. So then when you're diagnosing them and feeling a situation, you're able to do that. In this case, it was very basic. It was a sinus infection. So it was sinusitis. It was a basic acute sinusitis. Now, what I'm trying to just prove here is that there are many of diagnoses that you can treat over telehealth. But my disclaimer is to anyone is, you want to wait. You want to wait about a year to 2 of your training after you've been certified to feel comfortable. Not that anyone can't do it. It's just so that you, as a provider and as a medical doctor or nurse practitioner, your license isn't in jeopardy. I mean, you can be safe majority of the time, but you just want to do the best for the patients. And you don't want it to be something more serious. So something that could have been more serious if I didn't know is these temporal migraines. They could have had, an aneurysm or something, or, some sort of tumor in the pituitary. There could have been something beyond that. But from the general conversation with this individual and the history more taking than I did, it was just a basic sinusitis, and I treated her with medication. Let's see. Does anyone have any general questions yet so far?
From what I'm seeing, not yet. Although one question we do have is just generally, not with the case, but generally with telehealth.
Yeah.
Prior to COVID, how much of an emphasis was put on telehealth?
So I believe that telehealth was not so I've been a consultant in the telehealth space. I did a lot of stuff with Google and Amazon, and I was a big advocate for it prior to the pandemic, in the sense of trying to meet the patients where they were. Prior to the pandemic, I would tell you that the laws were very strict, meaning, so you have to be licensed in every state. In addition to that, the laws to practice in a telehealth space were not really like friendly for everyone. So they weren't willing to let the providers do as much. And I think now they're like, thankful for telehealth, and I'm grateful in a way. Like I said, COVID was a good and bad thing. There was a lot of negatives, but I think it came out in a lot of learning curves. So yeah, I think prior there wasn't as much, but I believe that the digital health space is evolving rapidly. And there's so much, if we can keep combining the diagnostic tools and then empowering the patient, it's going to be profound.
Also, in terms of, you mentioned that nurse practitioners can take fellowships and specialize.
They can.
With that said, outside of primary care, could they specialize in something like orthopedic surgery or psychiatry? How far can their
Absolutely.
specialization go? Is it limited?
I have to say, as a nurse practitioner, there is limitations. There's definitely limitations in the sense of, I'm not going to be a surgeon. I will never be a surgeon, but I can be a nurse practitioner surgery assist. I can work in the surgery, in surgeries with a doctor. So I can specialize in orthopedic surgery with a orthopedic or cardiothoracic doctor but I have to specialize and do a fellowship and be on RN FNA, meaning first assist so there is different levels that I would have to go to if I was going to be specialized in areas. But yes, I can do psychiatry is so nurse practitioners there is a psychiatric nurse practitioner certification. The orthopedic specialist is more of a fellowship. The surgery is a fellowship, but it also then needs more training because then you have to certify an OR and first assist. So that's another area. You can do procedures though. A lot of like I can suture, I can do basic things on my end. I've done emergency side, but if you're going to do orthopedics, and you do want to have training in those areas, because it's not best to just go in practicing something without understanding. So those fellowships are needed for all for a nurse practitioner. It would be best for them to practice. If they are not, I mean, I would be concerned.
Also, another question about nurse practitioners and PAs. What are the differences between what they're able to do and when they need to be certified, or also specialties that they're more prominent in? Any differences in general between those two professions?
I think so. A PA is a physician assistant. A nurse practitioner is under the nursing model. A physician assistant, I think, has a little bit more ability in the sense of working with the doctor in any area, and may not need as much certifying they may not have to specialize as much as a nurse practitioner, because our model of care starts in one way. So we need to learn the medical model and what we're trying to practice. So I think it's necessary for me to be specialized in an area. Now, as a PA, I think there's a little bit more leeway because the physician assistant is an assistant to the doctor. So not that in any way that means it's negative. It's just there is a different certifying board. I have the ability for independent practice. I'm not sure if a PA has the ability for independent practice. I do have a small clinic, but it doesn't mean that just because I have independent practice that I don't utilize my collaborative team, because you can't do this alone. Medicine is a lot, and you're practicing, right? So, but the PA field is a very respected and amazing team that I've worked with and people. I think that it just depends. It's a different learning that is initially taught, but when you're practicing, it depends upon how you want to practice. So it it does depend upon where you want to go. So as a PA, you have more ability to be in the clinics of where you'd like to work. If you want orthopedics, a lot of PAs are usually in an orthopedic center. A nurse practitioner can be, but they still have to specialize. PAs usually have access to more of the ICU settings, unless if not, then I would have to be in acute care. So if I wanted to work in an ICU now as a nurse practitioner, I'd have to get my certification as an acute care nurse practitioner. Then I would be able to work in like pulmonary ICU or cardiac thoracic, but I have to then certify in those areas because I don't have that training as of right now. I did as an RN ICU, but that doesn't equate over. Some of that training does. I could do hospitalist work for me, but not all individuals can. So I think that it's definitely the boards are different. They're different governing bodies. And it also has different backing and needs. So that there's I think the medical board is with the PAs. I don't know if they still have to license in many different areas. Nothing negative. That's just different governing bodies and different needs. And the specialties are different. It depends upon what you need. Like if you're not into being outpatient, then, really go for acute care nurse practitioner or PA area and inpatient. Does that help a little? Or does that make sense?
Very, very helpful. It makes a lot more sense when we consider from the perspective of who exactly is making those decisions. Like you said, the governing bodies are ultimately making the protocol for who needs to be supervised. It differs by state also. I know that.
Yes, I'm very grateful for being a nurse practitioner because our governing body has been a very huge advocate for us and realize that we're not here to take over a doctor's position. We're here to be the helping hand and be a collaborative component. So when we're given these independent practices from the states, we're giving it to some give it right away, others give it at least with years of experience, which makes sense, right? If you're a doctor, you're not going to just be a resident and then just see a patient. Everybody needs experience and time. So the governing bodies that have helped the nurse practitioner get independence is, I think it's just trying to make it a collaborative thing. But I know that there's been back and forth with that. But I think there's a respect now through as a whole, because even the pandemic, we're here to kind of be that extra. I call it the bridge of health, and kind of connect us all together.
Absolutely. Well, that's all the questions we have for now. I'm sure that we'll have some later on in the
Sure.
session.
Okay. And then so for this patient, the sinus patient, I'm not sure how we are in time. We're probably okay. And I just did a saline irrigation. I had them do saline irrigation is nasal spray, and then I had them do a steam shower and drink fluids. Because I'm an integrative practitioner, I do discuss supplements and I do discuss different types of alternative practices that have research base that was helpful for patients. In this scenario, I offered them magnesium, which is a vasodilator, so it has helped with discomfort and anything of that nature. In addition to that, they were given antibiotics of Augmentin because it was a sinus infection. And if I had any inculation that I wasn't needing antibiotics, I would then send them out for blood work to check for white blood count in that patient if I didn't want to give them antibiotics right away. I ended up giving them Tylenol for advised Tylenol or Advil for just discomfort or pain, and then Flonase for after for BID. Case 2 was an in-office visit. I had a 25-year-old female. Her chief complaint said, "I'm just more tired. I'm working long hours." She had a headache for about 3 days. She said Advil wasn't working. Her sleep wasn't very good. Overall symptoms, she just said she was yawning a lot, euphoria, depression, irritable. She was craving food. She had constipated. She had neck stiffness and pain pulsating over one eye. Now, what this could be, differential diagnosis is. Does anyone think that what this generally could be? Or I don't know if you have but there is different things that this could be. So pain over the eye could have headache realm, could have a severe tumor, could have a diabetic uh, ocular issues, could have just plain vision, meaning that they need glasses. It could be that they're dehydrated. It could be a thyroid issue. It could be there's an array of things that that could be going on with this patient. Especially constipation, cravings could also just be a plain anxiety situation. Could be something further, or IBS even. What exactly was this patient? Thankfully, it wasn't anything severe, but prior I took blood work. So I did blood work to check for thyroid. I did blood work to check for and to discuss like if constipation, what she was eating, what was going on, because I wanted to make sure it wasn't just a tension headache. She did have a diagnosis of a tension headache by the end of this, but previous to that, my treatment for her was for the tension headache was relaxation, sleep hygiene, food avoidance, ergonomic techniques, massage, acupuncture, and hot cold therapy. Previous to this, if I didn't think if it was a tension headache, I feel like with constipation could be thyroid. So lab work, I would do a look in to see like what her food situation has been. Is she eating less? Does she have depression, anxiety, things of that nature? So I might do a PHQ, which is looking at a depression on that patient. I would see kind of where their sleep patterns are. So with a lot of my care, it comes down to looking a lot of lifestyle medicine, where what their overall exercise, their movement, their sleep, their overall care is. Then I have to really peel back the onion to see, is there something further? Do I need to do a lot more lab work? Do I need to kind of see what their history is? Where do they live? What's going on? What's their stressors? Things of that nature. So there's other components that come into play here. But for her, it wasn't too complex. But in the clinic, you can get many things, right? Just like in a telehealth visit, you can get many things, and you still have to put out your feelers of what you think and hone into the research. The greatest, additional research that people have now is up to date, and there's a lot of that's one evidence-based research that you can use, and there's a lot of good available peer reviews on things if you have questions, and available resources for when you are seeing patients, and then of course their experience. And then case 3 is probably the most interesting that I had recently. I mean, not the only one, but it was, what I find is that women come into the clinic, or when I go into an urgent care setting, they don't always will tell you the full picture. So in this case, I was in an urgent care setting. She was 52 years old. She was a teacher. She said had been very stressed from COVID. She just came in with the thought of just fatigue, stomach upset, jaw pain, and a little trouble sleeping. Again, previous clinic patient just had a headache, right? So if I just said, okay, she has a headache, and let this person go with, Tylenol or a cold pack, I would be in trouble. So the next part of this is that her previous medications were multivitamin. She was on some Tums for a little upset stomach, a little anxiety previous. So she had been on Buspar, which is a general anxiety medication, but she's not taking that right now. She says overall she's managing, but she's a little tired. Her vitals at the time of the visit was 140 over 86, and her pulse is 112. That right there gives me a little indication of a red flag. Why is it 144 over 86, the systolic, and the 86 is still pretty high for that for the resting, and her pulse is 112. Why is it 112? Why is it racing? Not racing, but it's over 100, so it's elevated and tachycardic. She has intermittent palpitations, and I had to do an EKG on her at that visit. So her pain level was about a 5. She had irregular rhythm, but it wasn't full irregular rhythm. If I hadn't been listening pretty regularly, I wouldn't have heard it. And I did have to do an EKG on that visit. So in the urgent care settings and in the ER, you can do a full workup. So I took advantage of that availability. So I did EKG, I did blood work, I did a I-stat. So I was able to do some blood levels, with the exception of I was not able to do a troponin, but most of that she did have. Denied that she had chest pain, but on exertion she got tired. She did have a little nausea, a little vomiting. On the EKG, I wish I had it with me, did show a irregularity and did show a possible second block. Now, when a second degree block on her A node. Now, I thought initially if I had just let her go with this fatigue and upset stomach and just treated her for like a gastritis, I would have been in trouble. I'm thankful that, with the doing more lab work and doing an EKG, I felt that she was having a heart attack. But I wasn't sure. I said, well, it could be a possibility. Let's let you sit down. Let's put you on oxygen and let's reevaluate, because I think we need to. I was in an urgent care setting that was attached to an ER, so the it's a kind of a step down. So then you transition to the more near situation. Now, I'm not sure if you guys know what labs are needed for when you're looking at possibilities for heart attacks or for anything further. You look at troponin levels, you look at CRP, you look at, there's a list. If anyone has any questions on that, let me know. But in this situation, this patient was actually having early stages of a myocardial infarction. And the thing is that she was not really that sick when you initially kind of think about it. And you have to always think that there could be some things more going on. And whether you're on a televisit, a clinic, or in person, you still have to think worst case scenario. I want to make sure I'm helping this patient to the best of their ability. And you don't want to just miss something like this. It was so subtle, somewhat, but a little indigestion, jaw pain are pretty big, are signs. And indigestion everyone can have. Shoulder pain is pretty big too for women. But you don't want it to like just mess up. And as the visit progressed, she was starting to get a little bit of shortness of breath. So then we had put some oxygen on her, and then we transitioned her over into triage into cardiac cath. And then she needed an echo. And then she was overnight stay. So that was that visit, and we ended up overall saving her life, thankfully. I've had many other visits, close calls, but I feel like I've been able to, help many different individuals in different settings. So I'm grateful for that as a nurse practitioner. And I hope my information has been helpful, and I can, send out more detailed things. I wanted to kind of keep it a little bit more subtle and concise. But if you have any questions, please let me know.
All right. Well, first of all, thank you so much, Damaris, for all of this here. It's really helpful for students to see what it looks like across different settings, hearing from your experience, given that you have so much diversity of setting from telehealth to in-person. Really, really great to see. So we do have a few questions for you. And the first is going back to your background. You mentioned you're a US Navy veteran. How has that shaped you to become a better nurse practitioner?
So I have a lot more resiliency, and I feel that I'm not afraid to see. I mean, as I do like ER trauma, and I try to meet my patients where they are, because I feel like my own health journey helped me become a better provider. So when my own being as a veteran, I became like stronger from that end, but then I also wanted to be stronger for my patients, because I had to deal with some health issues. And then growing through that, then I was like, if I can do this, I know that I can help and teach my other patients and teach them get better. So it's it's kind of a circle came back, but I think it's important as a veteran. I think that I, not just serving my country, but just, looking at it as the whole picture, and that we're one country, no matter what's going on. It's the patient and not all of this other stuff. It's just trying to, make a difference.
Also, on the same kind of vein, on the same topic,
Yeah.
I wanted to ask about the VA. So, have you ever considered working at the VA as a nurse practitioner? Is that as common of a thing?
Oh, yeah. So there are nurse practitioners. There's so many nurse practitioners that work at the VA. I do not work at the VA, but I have my colleagues, plenty of colleagues, and many nurse practitioners are directors. There's a surgeon. I believe the Surgeon General is a nurse practitioner now, assistant surgeon direct, not the Surgeon General, but the assistant Surgeon General is a nurse practitioner. I don't quote me on that, but I believe that from what we were, and there's also a public health sector. There's a large group of veterans that were nurses in the VA, and then they became nurse practitioners and doctorates. So and they stayed their entire career in the nursing field in the military. I did not do that, but I do have some of my colleagues that were 20-year plus military.
All right. Well, a lot of involvement there. Another thing is for you specifically, what pushed you towards the path of becoming a nurse practitioner instead of a doctor, a PA, a physical therapist, or other
Yeah.
fields?
So for me, it was more of the transition because I had done military training. And in my military training, the LPN was kind of grandfathered in for me because I had done suturing and I was like a corpsman trained. I actually had another job, but because I was so into the medical field, I went and did extra training as a corpsman, and I did trauma train. So that trauma corpsman training was equivalent to an LPN certification. So I took that, and it's kind of a paramedic LPN. I could have done one or the other. And I went the route of an LPN at that time and was able to transition. So for me, it was just more of the stepping stone for me that worked out. I ended up taking, training to see if I wanted to go further. But so that was the direction that worked for me, but that's not for everybody.
Also, you have a podcast to go along with that. So, what was the motive there?
I do have a podcast. So my podcast is monthly integrative. The motivation there is because I'm so passionate about whole health and integrating a traditional approach with a whole health model and looking at different modalities of a collaborative approach, really looking at that there's no one pill to fix things, and that there are other things like meditation and music and art therapy and um, herbs and homeopathic medications, but all with a integrative and safe approach, as long as there's an evidence-based approaches to things, and taking it to realize that each person is different and that they have different needs. So that's kind of the podcast, was me now interviewing many different individuals that have given inspiring stories or successful health stories where they have been able to overcome. And so I kind of interview a lot of people about that. And then I give health information and education also.
Just like you mentioned earlier, there's a lot of resilience to your path. So, we're curious to hear, were there any mentors along the way that helped you out? And if so, any stories that you could recall that might be interesting to hear?
Oh my goodness. We have enough time. So the my so I have different mentors throughout my life. One to kind of different. I had an aunt that like a family friend aunt. I call her aunt. She was a nurse and she got me into the medical field. Her husband was a surgeon. And I knew that was she was always helping me to grow. And so that was one mentor that just really was always been very impactful on never giving up on my dreams. And then military wise, I had one commander that, when things were tough and down and out, she was actually a captain, and she was, she grew and was like, you never know where you can end up. And, she ended up being a commanding officer, and she was a woman. And back then it was still kind of taboo, for women to be commanding officers. And she was pretty motivating. Other areas in my nursing career, I've just had patients that have also been impactful to, help me keep going. And then, recently I've had like my father had passed from the pandemic. And I had wanted to change my perspective even more. So the podcast came out even from that. The integrative approach came up because of my own health history. So when I was in the service and I was in during 9/11, I had a um, a trauma that caused me some injury that I had to learn how to speak a little bit more, and my disability, overall it was more difficult. So I was trying to find different ways to get my health to be at 100%, and I wasn't exactly there, and I said, oh, I've got to figure this out. So I just never gave up on it. I just kept going and going, and these different mentors throughout were always telling me to just never give up, and so I just haven't. And that I think that I've also read a lot too. So in the mindfulness, I've read and had some spiritual leaders, and kept my faith. So that was important too.
So we discussed a lot about telehealth. It's not something that we'll usually hear
Mm.
on shadowing sessions. We might have had one other shadowing session before on the topic, which is why I wanted to ask, where do you see telehealth going in the future in terms of advances?
I think it's huge. I think that if every clinic and every hospital will have some sort of telehealth component, and if they don't, I think they're going to have problems. Um, and I think of that because to really give full access, and I'm talking about in the world, not just like the United States, to give real access to the like third world countries. I was on this one panel and worked with, there's technology now that's coming out that you can see patients across the world, and the diagnostic tool just has to be shipped to those, third world countries, and we'll be able to do ankle brachial pressures, four pressures, and EKG, and heart lung, and then the most profound thing is that, like, it's almost going to be like sci-fi between precision medicine, the DNA, and then looking at technology. If it's done well, and it's accurate, things will be good, but you still will need the human element. So the human isn't going, as providers, is not going to go away, because you need still that part of what is this correct? Is this not correct? You still need to talk with the patients and such. So that part won't go away, but the technology is probably going to be more advanced. Some people may think it's negative. I try to look at it, the positive of it, because I think that it could make us better providers if you have accurate information instead of us just guessing all the time. Because when things become more accurate, then you're really making real profound decisions. So I think it could go very well in the long run.
And similarly, how about nurse practitioning? Where do you see that going in the future?
Um, Even in this last 2 years as a nurse practitioner, my role has been pretty amazing. Like I said, I have multiple licenses in multiple states. I know some nurse practitioners that have almost 50 licenses. So they're practicing in all states. And we're able to, because of our governing body, have given us a lot of broad range in our scope of practice with safety, doing it safely with the hours and with our training. So I think it's been pretty great. And as long as we all work kind of together in the most collaborative way, I think a nurse practitioner is a good component for the field, as long as it's seen as a benefit and not a hinder.
And I think we'll end on one more question. Just reflecting back when you first started out this career, what was it like in comparison to what it is now? The differences?
Mm. As a nurse practitioner.
Yeah, when you just started out school, what was it like?
Oh, so when I first started out, I mean, I had a lot of anxiety, just trying to figure out what to do with patients, what was going on. Um, it was also it felt harder, just like when doctors in a residency there, you're still trying to get through the little kinks of things and learning. I also felt that there was a lot more patients that have to be seen. I think that there is a little bit of, depending upon the setting, you can work around the amount. And the initial part too was just unsettling initially, but I think through time and experience and learning what you want to give the patient, like what your intuition, like starting to listen to your intuition and starting to see what you want to do for your patients is the benefit. And then also what the scenario, like if it's an acute setting, you're fixing the situation on hand. But if it's something more chronic, those things take a little bit longer, and to have a little patience with that. So I think when I was initially starting, I had all this, excitement and such, but realized that the pause, the time, and kind of the step back and where was going on with the patient was a little bit more important than just fixing. So it was definitely a change, and with time and experience, I realized that you learn more with listening.
I'm sure. Well, I think that's a perfect point to wrap up today's session on. Thank you again so much, Dr. Damaris, for joining in. It was an honor to have you here to talk about this specialty. Like I said, for one of the first times on shadowing here, we've had, I think, nearing 50 sessions, but this is finally one of the ones that we can get around to some nurse practicing. So we're very, very happy to have you here.
Well, I really appreciate it, and thanks for having me on. I hope that I gave your listeners and those watching a little bit of value and time.
Absolutely. I have a few last reminders in terms of the quiz. We have a quiz for our shadowers, and that quiz is to earn attendance, to earn credit for your attendance. So you must pass that quiz to receive a certificate with at least 60% or above. We have 10 questions total, so that's going to be 6 or more questions correct. That quiz is now included in the chat box, the same place that questions can be written. You can also click the quiz link. It's a Google form. Like I said, 10 questions. It's also available on our virtual shadowing page on our website. So either way works, the same quiz. And this quiz will be due next week on the upcoming Wednesday, September 28th at 11:59 p.m. Central Standard Time. So just make sure that you get it done before then. If you do have any questions, let us know. We do have a certificate, like I said, that is generated after passing the quiz with at least 60%. So that certificate will be sent to the inbox, the email address that you list on the quiz. But I do want to note that sometimes there are some difficulties with getting that certificate through. So just in case you don't find it in your inbox, please check your spam folder. We also recommend using a Gmail or a Yahoo or any kind of personal email as opposed to school emails, because school emails sometimes filter things out. So those are just a few technical things to keep in mind. Although if you don't find it at all within your inbox or spam folder, please reach out to us. Again, our email is shadowing.h4h@gmail.com, and we'd be able to get in touch with you and retrieve it. With our next shadowing session, that's going to be next week. Like I said, on a Monday and Thursday schedule is when we have these shadowing sessions. So we're going to be with Dr. Chung. He's also a veteran, a retired Army colonel. He's the past second vice president of the American Burn Association and has served as the critical care consultant to the Army Surgeon General in the past. So he has a lot of experience in critical care. This is going to be a physician, but we do have a range of speakers, especially after this summer. We've integrated that into our virtual shadowing program. So if you're looking forward to any speakers, like I said, following us on Instagram or through our listserv are great ways to do that. We're going to see him also at 7 p.m. Central next Monday, September 26th. So be sure to stay tuned for that. Those are all the details that we have here. And if you'd like to hear more from Dr. Damaris, you have an Instagram if you want to quickly shout that out.
It's just at Mindfully Integrative, and you can reach me at that and be glad to help. And my website's mindfullyintegrative.com. Have a great day, guys. Perfect. And if you need anything, just reach out at any time, okay?
All right. Well, we'll see everyone.